isotonic is when the weight, the force you're pushing against or pulling against is not changing, okay, through the movement. But isometric is when the load is not moving, okay? The muscle is just contracting against the force. So even just pushing down on this table, that's an isometric contraction.
What about going like that? Same thing?
That's isometric.
Okay.
Okay, it's not moving at all. Okay?
So you pick up this.
Isotonic.
Isotonic.
Okay.
It's isotonic. So if you can wrap your head around those two definitions, I might give you like one true false.
Okay, isometric is when it's not moving.
Yeah.
So like if you're
That's a
going
wire. That's not a rubber band. That's a wire. Okay, it can't move.
So you're
But
just
you're
pulling against it,
contracting
not
it.
moving, and keeping the
Right.
muscle contracted.
Keeping you're using
trying.
force in the muscle,
Isometric
but it's not moving.
exercise before
Okay,
that.
that's one. Same thing, no weight. Just
Yeah,
moving.
that was one that went along with
Well,
it.
you could say the tone doesn't change, but really what you should think about is that the force that you're working against doesn't change. Okay, so this will have a certain force from gravity, and I'm working against gravity to do that, but it's the same tone, the same force all the way through the movement. But it would be different if I was pulling on a big rubber band. You know, the more I pull, the harder it pulls back. So that is neither isotonic or isometric. Okay.
What is that?
And there's some argument about what is the best way to work out, you know. Should you have mixtures of isometric and isotonic, and you get gurus on both sides and doing all sorts of things.
So what you think?
The isometric workout was when I was a little kid in comic books. You know, everybody wanted to look like Charles Atlas. Yeah, yeah. So.
I think we both have been.
I think working out in general.
Yeah.
Resistance training, right?
Yeah.
She's a
Okay, just some more terms we need to get through here. Agonist and antagonist. And I don't know that I've got the word synergist anywhere on the slides.
We don't have that slide.
We don't have that slide.
Oh my gosh.
Yeah,
All
it's all
right, just write the words down. Okay. Sorry, you got to take some notes. I know it's tough, but 2 words, all right? One is agonist, and one is antagonist, okay? Whatever motion you're talking about, whatever action, if I'm flexing my elbow, the agonist is my biceps. That's what's flexing the elbow, biceps and the brachialis, okay? The antagonist would be the triceps, the one that does the opposite. It extends the elbow, okay? So they work in opposition to each other, okay? Just like you could say that the sternocleidomastoid is an antagonist to itself, okay? One of them is going to turn my head to the left, the other one wants to turn my head to the right and undo that action. So they are actually antagonists to each other, okay? A synergist is a muscle that will work with the agonist, okay? So the brachialis. The brachialis helps to flex the elbow as well. So it's a synergist for flexion of the elbow.
GYS or GIST?
S-Y-N-G-E-R, syn, or N-E-R, S-Y-N-E-R, G-I-S-T, synergist. Okay.
You said GYST?
GIS.
GIST. Okay. So a synergist works with the agonist.
Yeah.
Okay.
It means together. Synergy is togetherness. Okay. Syn again, S-Y-N, and Greek means together.
Okay.
Okay. All right, and I think that's enough to make the point. Okay. I won't spend a lot of time on that. I think I threw this in a couple of years ago just to show you an example of an agonist and an antagonist. And it depends on the action you're talking about. Okay. If I say, what's the agonist for flexing the knee, it would be the hamstrings. Okay? They're in the back. They attach to the tib-fib area here, so they're flexing the knee. So if I'm talking about that, they are the agonist, and the quadriceps would be the antagonist because that straightens the knee. Okay? So it just depends on what action we're talking about. Okay? You're not going to always label this as the agonist. Nice pictures here, though. I think you can. This is really good to see how the hamstrings come up and attach to the ischial tuberosity there. You can see where the biceps femoris comes down. They have to pass the joint. They have to go on the tib-fib area so that they can pull that to work on it, okay? If they just came down and attached to the femur, not what happened. Okay, it has to go past the joint and attach to the tib-fib, okay? And here, the quadriceps, you can see that because most of the quadriceps, the only one that actually passes the joint up here and goes and attaches to the inferior spine here, the inferior spine,
Talar muscle.
that's the rectus femoris. That's the only one that will help you flex the hip. Okay? The others come up and attach around the greater trochanter, so they have no action on the hip at all. So when I flex my hip, I'm using my rectus femoris and my iliopsoas. The psoas major and the iliacus that's come down on the lesser trochanter, they're all pulling up. Okay? So these are where you get the power to flex your hip. Okay?
What is the sartorius muscle doing then, the talar muscle?
It's helping you cross your legs. You can
Okay.
see it attaches to the superior spine here,
Okay,
runs all the way across the joint, okay, and down here it attaches on the medial side.
okay,
So it will be a slight hip flexor because it crosses the joint.
okay.
But what it's really doing is pulling the medial side closer to the outside, which means I have to twist my leg. Okay, so that's why they call it the talar muscle, because you sit cross-legged when you're working.
Is that the Suzanne Summers muscle? The
Well, she was
thigh
the
master, yeah.
That's the adductors.
That's the adductors, okay.
Yeah.
Okay.
The gracilis. The
Okay.
gracilis and the
Okay.
adductor longus, adductor magnus, and you're working the thighs in and out.
Okay.
Okay. Yeah, good old Suzanne Summers. Okay, we'll pass on that. This is before I got sick. The chemo really knocked me out. No, this is undoubtedly Photoshop, gang. Okay, undoubtedly Photoshop. But a few of the muscles you can probably pick out, though. Okay? Whatever we're going to do.
Trap.
Deltoid,
Delta.
pectoralis major, biceps, brachialis maybe right here, triceps, brachioradialis
Well, I
here,
don't want him to touch me.
That's so gross.
rectus femoris, right?
That thing probably.
Well, the rectus femoris here, rectus abdominis here. Maybe the sartorius coming across here, right there. Vastus medialis, vastus lateralis. Yeah, this is the kind of guy you were talking about who busted his biceps and blew out his arm. But no, this is Photoshop. Okay, but all in all, I just want you to get these two terms, okay? Hypertrophy and hyperplasia. That's the whole point of this slide. Know the difference between the two. And just to talk about it a little bit, hypertrophy is when you increase the size of a muscle. You can do this with weight training and exercise, that sort of thing, but you're not increasing the number of muscle cells. You're pretty much born with the skeletal muscles you're going to have all your life. All they do is get bigger and longer by growing, okay? But when you build muscle, you're laying down more of the sarcomeres, more protein, you're retaining more fluids, the osmotic changes, pressures change, you're laying down more mitochondria, you're laying down more glycogen in the cells, so they're just getting used to all the activity, and they're basically puffing up, okay? And they will puff down as soon as you stop doing that, okay? But hyperplasia is actually a term for an increase in the number of muscle cells, and I think this is pretty much true here. I can't refute this. It says it generally is agreed that it happens only in smooth muscles such as the uterine wall and the intestinal smooth muscle, okay? Because it'd be kind of hard to, all the smooth muscles are microscopic in size, okay? They can't grow a foot long like you can a biceps brachii muscle cell, okay? So you pretty much have to increase the number of them if you want the intestines to get longer, or if you want the uterus to get bigger, okay? So that, they agree that that's where you get hyperplasia, and you get growth of muscles by increasing the number of muscle cells. But in skeletal muscle, it's pretty much just hypertrophy if it's getting bigger. Okay? So that's the difference. And you'll hear the term hyperplasia in all sorts of ways, you know, biopsying skin cancers or whatever. The pathologist will always come back and say, hyperplasia, this type of cell. So there's more than there should be, basically, okay? Hyperplasia of the melanocytes in melanoma and that sort of thing. So you'll hear these two terms a lot. And this right here, the hypertrophy, one of the common ways that you'll hear it and see it is in the heart. Yes. Cardiomegaly is a term for enlarged heart, okay? But it's basically hypertrophy of the heart muscle. The heart muscle is getting bigger, okay? And this is pretty much PDF too. I mean, we're talking pathology again, right? But this is a normal chest X-ray. I think you all can see you've got the heart kind of slightly over to the left. The lungs look pretty clear. You can see the arch of the aorta coming up here as it goes back down. You see the air in the trachea, and it goes off here to the bronchus. And as the walls get thinner, they start to just look like air here. Okay? There's an air bubble in the stomach. Okay? Ribs look pretty normal. This guy has clavicles, as opposed to some of the other. This is a nasty looking heart. Okay? It's sometimes called a jug heart because it looks like a jug. Okay? This can happen for all kinds of ways, and anything that you can think of the heart as a water pump. Okay? So you have the pumping mechanism, you have the valves that let the water in and out, and you have the electrical system that controls the motor. Okay? Any three of those systems can go bad to give you heart failure. You can have muscle cardiomyopathies, okay? You can have valvular problems. If your aortic valve is too constricted and it's stenotic, that heart has to push a lot of pressure to get that blood to go through there, and it's going to grow like any other muscle that you're working out, okay? Or if it's pushing against high blood pressure, it's going to grow. You get a bigger heart when you have high blood pressure that's untreated, okay? And eventually you get things like this, okay? And eventually, but it's not like a muscle that's really worked out and in shape, okay? What it is a muscle that said, man, I had to do this just to keep doing my job, but now I'm burned out, okay? And it's just going to fail, and that's called congestive heart failure, okay? If the fluids are going to back up, the cardiac output can't put out enough fluid to keep it circulating around, so it basically starts to back up in the lungs, it starts to back up in the lower extremities. If you're sitting or standing, you get swelling of the feet, you get fluid in the lungs, and that's what kills people. And basically, they suffocate if they don't get it treated. Yeah.
That's kind of what I was going to ask was, when you said that regular skeletal muscle, if you stop using it, will go back down. So the heart muscle is not like that? It won't go back down?
No, it will if you start treating it. I mean, this looks like it's too far gone. Okay, but yeah, you can get a little cardiac enlargement, and if you treat the high blood pressure, the heart will go back somewhat to normal.
But that doesn't mean
in
that
the early
it's not
stages.
Damaged, right?
It's all relative, you know. It's just how far did it go, and you know how much did it come back. So there's no rule. But yeah, once you treat the disorder, the heart will tend to get smaller again, more efficient.
Okay, so like that muscle builder there, is his heart going to be like grow bigger just to be able to pump all that, or is it going to?
No, not necessarily. Not. It's only with aerobic exercise really that you get the big hearts.
Actually, it's common in bodybuilders that they have high blood pressure and they have higher because they're making their heart do so much work, but they're not doing the cardio training to.
Right. Yeah, you can get some heart issues with it.
So the
It's a
aerobic-
perfect example. A friend of mine got into bodybuilding just for egotistical reasons, I think. And he was one of these big shoulder pumpers, always wore the tank tops.
Yeah.
And then he decided he wasn't doing himself many favors because his blood pressure was sky high.
Yeah.
Okay. Then he started to get into working out and getting into marathons and triathlons and things like that. He now looks like a marathon runner instead of a bodybuilder. All that muscle's gone.
Yeah.
He lost like 60 pounds.
Yeah.
So if you do the aerobic,
Without trying to
like
lose weight, the muscle just
running?
disappeared.
So if you do the aerobic,
Yeah.
where you're working your heart the right way,
Yeah.
it grows and it's okay? I mean,
Well,
it's not.
I can't say it'll be all right forever, because then what happens when you stop working out and you're a 75-year-old guy with a heart that's twice the size of normal?
So what happens with that?
I haven't seen much of that, because you don't see many marathon runners that are 75 years old yet. But we're going to see a lot of them. Okay? But Lance Armstrong, he's supposed to have a heart that's 3 times the size of normal.
Really?
Yeah, because he's been doing all that working out. But it's a very efficient muscle right now. okay? He's got a very high cardiac output, okay? So he can send
What about
oxygen
that
to
guy
muscles a
that-
lot better than I can.
Did the exercise program way back.
Jack LaLanne.
Jack
just
LaLanne.
Yeah.
He didn't look his
Well,
age.
He's right, and he stayed pretty healthy, but he didn't overdo it.
He just
He
didn't.
wasn't a bodybuilder. He was just, he was
Right,
into
okay.
fitness and a little bit of aerobic exercise. He wasn't a marathon
So that's the
runner.
difference, is doing it in the right amount. And
Yeah, exactly. Moderation in
about
all
the,
things is
Jack
always a
LaLanne
better.
was more of a, but he was more into like, eating, right, like juicing,
Juicing.
that was his thing.
Yeah.
Yeah, he did a lot of juicing and stuff, that was his thing.
Well, I'm sure that kept his cholesterol levels under control, and, you know, so he lived a pretty healthy life.
well, is your pulse rate, is that the amount of times your heart beats?
In a minute.
Well, people that have extremely high pulse rate,
Mm-hmm.
but don't have high blood pressure, is that bad?
Yeah.
What does that do?
Well, that can wear out the heart too. You get all sorts of hormonal problems that can